Okay.
Yeah, come on up. So, Leslie, come here. If we go Leslie, Christine, Ruth, I mean, it's going to be a gender balancing. Would you want to?
Like on the far side.
Okay, you go around there, Mike. Good. Christine, good. That's good. Good morning. Thank you for coming to this press conference, which is fully nonpartisan and focused on the crisis, the opioid crisis, the importance of harm reduction, and policies that focus on safe supply and decriminalization. I'm joined today, and we're going to have a speaking order as follows. I'm really honored to be joined by a number of the real experts through tragedy in this issue with Moms Stop the Harm. First, we're going to hear from Adam Van Koeverden, Parliamentary Secretary to Health. Then I'm going to invite Leslie Mcbain from Moms Stop the Harm, and Ruth Fox, and Christine Taylor to take the stage. Followed up, the closing words will be from Mike Morrice, MP for Kitchener Centre. So I'll just turn the microphone over to Adam.
Thank you, MP May. It's a real pleasure to be here. And Elizabeth, we call each other by our first names because we're friends and colleagues. And the reason that we're here today is because members of the Liberal Party, the Green Party, the NDP, and the Bloc Québécois have become increasingly horrified by the really fact-free rhetoric coming from the Conservative Party as it relates to safe supply and harm reduction in this country. We have to acknowledge that we have an opioid crisis and a poisoned drug crisis in Canada, and the type of rhetoric that's coming from Pierre Poilievre and the Conservatives right now is doing more harm. It's spreading mistruth, it's creating more stigma, and it's not doing anything to help people who actually need it. So I'm really glad to be joined today by Leslie, Christine, and Ruth, who I've just met, but who are familiar to everybody who really knows what they're talking about when it comes to the opioid crisis in Canada. I want to acknowledge that I'm a politician. Like Pierre Poilievre and Elizabeth May and Mike Morrice, I'm a politician, not an expert in the opioid crisis or really very many other things. That's why we rely on experts. We rely on experts for that academic approach, for an evidence-based solution, and since Canada at large has been employing a safe supply and harm reduction approach and an evidence-based approach to solving for the opioid epidemic, there have been tens of thousands of overdose reversals. Lives are being saved. This is not work that's complete, it's ongoing. But the type of fact-free nonsense that's been coming out of the Conservative side on this lately is harmful, and it needs to stop. So with that, I'd pass it over to Moms to Stop the Harm, whether that's Ruth, Christine, or Leslie. I'm not sure, but I'd just like to thank you for your time today, for coming here to Ottawa, and for sharing your lived and living experience, which is informing our government's actions on how we support people through the toughest times of their life. Thank you very much for being here.
Thanks, Adam. We are reluctant experts. We never wanted to be standing here, and we're standing here because our children have died from drug harms. We are advocates for the implementation right now, other things as well, but the implementation of a safe, regulated, legal supply of drugs for people who need them. We really want to implore the public to understand what that means. It doesn't mean standing on the corner and giving out drugs to kids, which has been sort of intimated by the Conservatives. We want to set the record straight. This project will be very highly regulated, highly documented. The research is there. The statistics will be there as well. We know that the only way to stop or reduce the horrendous number of deaths is to implement a regulated supply. I mean, people who are addicted to tobacco, people who are addicted to alcohol have a safe, regulated supply. They can use it unsafely, but it's up to them. People who are addicted, and I'm hoping the public understands addiction as we go along, need to have the drug they're addicted or dependent on. And they have to go out into the black market, which is run by the by gangs, by organized crime. So we are making people who are addicted and dependent go out into that market to get the medicine they need. This isn't how we work in Canada. We help people who have health conditions. We actually can easily compare what happens with people who are addicted and how they're treated with people who have heart attacks and how they're treated. They are followed for life. They have the best medicines in the world. They have the best doctors in the world here in Canada, but not so with people who are addicted. So we are working so hard to show that, you know, drug use is a problem, but it shouldn't be deadly. It should be treated, when people come into the ER, they should be treated with respect. They should be treated with ongoing care and support. They shouldn't be just turfed out the door, which happens everywhere across the land. Our kids died because they didn't have what we are advocating for. They didn't have services. They didn't have harm reduction. They weren't able to get into treatment when they needed it. The Conservatives say that they're going to build this fantastic amount of treatment beds and evidence-based and all of those things. And we agree we need those. But dead people can't access those services. So we're here to tell the world, stop the deaths. And we will say that every single day for the rest of our lives, because that's where our grief will be. For the rest of our lives, we're in grief because we lost our kids. Thanks. And I would like to hand it over to Christine Nayler.
So I've prepared something to say because I'm not as good as Leslie and when I'm nervous. So I just want to say I'm here in Ottawa today to stand united with advocates from across our province and country to advocate in support of safe supply and other harm reduction measures that meet people where they are and help to keep them alive. Our country needs to move forward, not backwards, when it comes to measures to address the toxic drug supply. Measures taken to date to address the toxic crisis have failed. The results of these failures are heartbreaking in the extreme. Since 2016, over 35,000 Canadians have lost their lives due to our country's failed drug policies. My son was one of them. 35,000. This is a number that is staggering, and it should outrage Canadians, and yet it doesn't. And why? Because of stigma. Every drug death is a policy failure, and it's a policy choice. Every life lost mattered. Every loss affects a family, and it leaves ripples of grief, trauma, and heartbreak in communities across our country. In November of 2020, our worst nightmare came true. We lost our son Ryan to a toxic drug poisoning. As much as I wanted it not to be real, to wake up and it all to be a bad dream, it wasn't. On Ryan's 35th birthday, instead of celebrating with our son, we buried him. Ryan lived with concurrent disorders, having both bipolar disorder and substance use disorder. The last 8 years of his life were a struggle. It didn't have to be that way, and I truly believe if society supported instead of shamed those living with mental illness and substance use issues, Ryan's story would have had a different ending. Ryan is dead because he was denied a safe supply of what for him was his medicine. It was a drug he found that helped him to cope with his bipolar disorder. Since Ryan's passing, my husband and I formed a nonprofit organization in Ryan's memory and honor. Our mission is to advocate for and support those living with mental illness and substance use issues and experiencing homelessness. Our work brings us into contact with so many people in our community that are struggling with substance use issues. We have needlessly lost so many members of our communities. These deaths were preventable. We lose approximately one member of our community a week. The toxic drug crisis continues to take a toll on our community and on our country. As a co-founder and director of Ryan's Hope and as an advocate for Moms Stop the Harm, I vocally advocate for decriminalization, safe supply, and other health-based measures to support people living with substance use issues. Public health experts, law enforcement, frontline workers, and people with lived and living experience have long called for a shift in Canada's approach to substance use, including decriminalization of simple expungement of convictions, universal access to treatment and recovery programs, but the access has to be voluntary. Forced treatment, we know, does not work. Yet instead of moving forward in a more health and evidence-based approach, to address this public health emergency, the Conservatives are calling for measures to reverse the small steps that we have taken and bring us back even further backwards with our country's drug policy. This will have devastating effects, and it will cost countless lives. This is why advocates have come to Ottawa to stand united at Parliament. The cost of us not standing up and speaking out is too high. Together, we will change policy, end stigma, and save lives. Thank you. And now I will. Are you going to speak, or Ruth? Yes.
Good morning. I've jotted down some words as well. In August 2020, my world and my heart were forever shattered when my youngest son, Trevor, died from toxic drug poisoning. Trevor died in his home. He did not have a history of problematic substance use. He was 25 years old and had a full and promising life ahead of him. I believe that if it wasn't for the stigma associated with substance use, criminalization of people who use substances, and the toxic supply, Trevor would be with us today. As Trevor's death illustrates, it is not only those who struggle with substance use disorder who are dying. Anyone who uses substances is at risk, and these are preventable deaths. We have a policy and social framework which judges, shames, and punishes people who use drugs. We need decriminalization of persons who use drugs and access to regulated substances, often called safe supply, within the framework of a compassionate public health care approach. An approach that respects human rights, meets people where they are, and does not stigmatize or discriminate on any basis. If there was safe supply, Trevor would be here today. Simply put, nobody has died from safer supply while the toxic drug supply has killed almost 35,000 Canadians since 2016 and continues to take the lives of about 20 people across Canada every day. Every day, 20 families are plunged into never-ending grief. Thank you.
First of all, I want to say my deep thanks, Christine, Leslie, and Ruth, for all you've done to channel your grief into the advocacy that our country so badly needs right now, and particularly to be here on this week, at a time when the rhetoric on Parliament Hill is putting politics above people's lives. It's so critical to have your voices heard, so that all elected people can be listening to your lived experience and the recommendations of experts across the country. A week also when we are nearing a one-year anniversary of a piece of important legislation from our colleague from the NDP, Gord Johns, that I recommended following advice from Health Canada's expert panel on substance use. This week is such an important week for you three to be here, and we all really appreciate it. I just want to underscore that this is the poison drug crisis is affecting Canadians right across the country, whether that's in Toronto, Montreal, Vancouver, or in a community like mine in Waterloo Region. In the first 4 months of this year, 36 preventable deaths from poison drugs. That is more than twice as many traffic fatalities in all of 2022 in my community. This is a policy choice, and it's why it's so important. I'm so glad to have Adam with us here this morning, to see the Bloc Québécois, NDP, Green, and Liberal colleagues coming together to say that this rhetoric we're hearing is not okay, and that we will together be united in pushing back and pushing for, as Adam mentioned earlier, evidence-based policy that will save people's lives. With that, I'll turn it back to Elizabeth, and we can take any questions that folks have. Thank you.
Nous sommes disponibles pour les questions en anglais ou en français. Please let us know as you ask your question which one of the presenters you'd like to answer.
Hi. I was wondering if Leslie or others from Moms Stop the Harm, I could ask a question to you. I'm interested in have you reached out, and I apologize for coming late, so you might have already answered this, but have you reached out to Mr. Polyev about trying to kind of maybe work through some of the differences around the policies you support and he doesn't? And if you have reached out, what kind of response, if any, have you gotten back?
Sorry, would you mind introducing yourself?
I'm Stephanie Taylor with the Canadian Press.
Hi, Stephanie. Yes, I've reached out to Mr. Polyev 3 times and received one automatic reply. I have asked that we have a conversation so that we could understand each other's point of view and hopefully find some common ground, but he has not responded. And I think that's actually quite important, the fact that he hasn't responded. It means that he and his party do not have the courage actually to find out the truth, to hear the truth, to be touched by the truth. And so I'm not surprised. I didn't actually expect an affirmative reply. And my expectations were met. So, no, he hasn't reached out. He hasn't reached back to me, and I'll try again while I'm here this week. But yeah, I don't think that will happen.
I guess what is your message to conservatives or other critics who take issues and question the efficacy of programs like Safe Supply? Because I think that there are some legitimate questions out there about, is this working? How is this working? Is this the best approach? What is your response, or what would your response to criticisms like that be?
My criticism would be, first and foremost, Safe Supply saves lives. And we women who are standing here have lost our children. We have studied this. We've read the research. We've seen the evidence. And so we know that this is true. I think that is the absolute most important thing. But there are questions. This is not a simple fix. It is a complicated fix. There's many pathways to safe supply. Which one will we choose? What can the government do? How much will it cost? And believe me, it'll cost a lot less than the way things are going now with law enforcement and border control and all these things. It will be much less money to make this fix. So that's the kind of things I would like. I'm not sure what their point is in stopping safe supply. It's political. It's horrendous. It's absolutely makes no sense to us. So those are the things we'd like to hear. We'd like to hear why. Why would you say this? What about the gap between if you didn't have safe supply, but yet you built all these other supports? What about the people that will die in between? Yeah, it's about death. It's about life and death.
Thank you.
Yeah, okay. If I may add, is just a little something. When we talk about safe supply, and I've been educated on this, by the way, I'm so honored that Leslie Mcbain actually, of course, the Parliamentary Secretary has to get to the Health Committee. Thank you for being here. Just wanted to say that when we talk about safe supply, if people don't understand the concept, it's because the drug supply is poisoned with fentanyl. It isn't what it used to be. I've had constituents come to me, others than Leslie, I've had constituents come to me who've lost a family member because of what they thought was recreational use of cocaine. But the cocaine had a little fentanyl in it. These choices that people make are, to use an illegal drug. Some people will be judgmental and say, well, that was their choice. But when the drug supply is contaminated and poisoned, people die from choices that are ill-conceived, but if we're allowing an unregulated, poisoned drug supply, when you could save lives by saying, we want to make sure there's no fentanyl in your, even marijuana. We want to make sure there's no fentanyl in your access to an opioid. We want to make sure there's no fentanyl in the cocaine. The poisoning of the drug supply needs to be understood by people that deaths are poisoning deaths more than overdoses. So it's a health issue, not a criminal justice issue. And the stigma and the discussion in the Parliament that led to us decide to get together was clearly militarizing language around helping people described as addicts on the street and not giving them drugs. And it was even said in Parliament that the safe supply and decriminalization involved giving people who are dealing with addiction issues drugs that they could then resell and then get other people addicted. The language was so far from the reality of the clear and present danger and emergency of the opioid crisis that we wanted to be able to say to our friends who are conservatives, stop this. Political rhetoric is one thing. Dog whistle politics is one thing. But as Leslie was just saying, political rhetoric mustn't be weaponized to the point where people die because of it. And that's why we want to say stop now. We don't want to hear this in a federal election campaign. Listen to the evidence. And please, to Mr. Poiliev and his people who are maybe watching this today, accept the meeting that Moms Stop the Harm want to have with you. Listen to experts. Listen to people who know what they're talking about.
Fraser Newman for APTN National News. I just was wondering, I guess for either, maybe for the MPs, if you could talk a little bit about particularly street drug uses. I know this is an issue that affects across all classes, but particularly in street drug use and what we cover in East Vancouver, it really affects the Indigenous community and other minority groups. So maybe could you talk a little bit about that, maybe and what other Canadians don't see, I guess, or what the Conservatives are appealing to?
Do you want to speak to
No,
this?
go ahead.
Okay, it's what we're seeing, of course, in areas where people where they have insecure housing. In other words, they're homeless. There's greater vulnerability. They are more marginalized and less able, even than the children whose parents you see before you today, who had access to supports. When you're cut off and you don't have access to supports, even in that situation, people die when they have the supports and they have a loving family. They can die because of the contaminated drug supply. When you're completely cut off from supports and you don't have a home and you don't have a door to go to close when you go to sleep at night, you're much more vulnerable, which is why, again, speaking to the complexity of this, the housing first principles really matter. Get somebody a secure place to live, and then the mental health supports come around that, and the addiction counseling and the help comes around that. For the Indigenous populations of Canada, clearly an urban Indigenous population is less connected to community, less protected. In the encampments that I visited at Strathcona Park in Vancouver, they had no poisoning or overdose deaths because they were community and they could look after each other and make sure that an antidote was provided right away when they saw someone in distress. The vigor with which various municipal councils want to eradicate communities of people living in encampments, I know it's not a popular message, but the people living there are safer than when the police come in and take away their tents and shut down their community and put them back out in places of total isolation. So the words of Gabor Mate always come to mind, that the opposite of addiction is connection. And the work that's done by people, particularly with Indigenous leadership, in reaching out and creating connection, creating community, creating places where people can access the helps and supports that they need, are particularly acute in the population you've raised today. And their health and their safety matters.
And maybe just as a follow-up question, I guess anyone can answer this, but maybe the MPs. Seen recently the government, aside from maybe good intentions to issues, bail reform, and also gun control legislation, back off from what they intended to do, not necessarily based on evidence, but on pressure from Conservatives and from other groups. Is there a concern, and I think it probably appears just by the amount that the Conservatives are spending on this, that they're probably going to make an election issue. Not, is there a concern that the government, in spite of good intentions, may begin to back away from some of its more liberal drug policies due to these pressures?
Yes. What we see, and it's these issues aren't simple, and understanding why it is that that keeping people longer in jail, the bail reform bill that just came through, is not going to make people safer. It's going to say people can be incarcerated longer while you're still waiting for trial and so on. There are many things that need to be done to ensure that Canadians feel safe. And so right now we're in a really critical and risky place where, coming out of pandemic, I think everyone understands that mental health issues that were always there have become more extreme during pandemic. Again, Gabor Mate, if the opposite of addiction is connection, and we've just gone through a couple of years where people were, as a result of pandemic health measures, more isolated, more left on their own. Mental health issues have become worse, just as gender-based violence issues have become worse. They were always there, but pandemic has strained our society. And one way that speaking to the larger kernel of truth in your question is, are we as a society more polarized? Are we more willing to go to a snap judgment that decides that you're going to actually decide that the person who's the victim in the situation is actually the bad actor? And the polarization of the conversation worries me a lot, because I like to think that as Canadians we understand always, and in Parliament I've always loved that we could disagree without being disagreeable. We're definitely losing that. And the rhetoric has become a lot more disagreeable. And I really hope that that the leadership in every party will look inward a bit and think about, we better put a brake on this now, because power at any cost can hurt this country, and power at any cost can cause people to die. And is that really the path you want, to be able to say, my party has now formed government, hooray for us, but what was the body count? Yeah.
It's a great question. Just wanted to offer two brief examples to follow up on Elizabeth's comments there. You can look at C5 as one example when it came to mandatory minimum penalties. Truth and Reconciliation Call to Action 32 called to move away from all mandatory minimums. It's a significant concern that we didn't even have the conversation about moving further ahead, because the rhetoric became about the governing party holding on to even moving away from a small fraction. And that's what we're seeing play out again this week, that rather than talking about moving further when it comes to ensuring we stop these preventable deaths, the rhetoric from the Conservative Party is eroding this conversation. We ought to be talking about moving further and faster to stop this crisis. Instead, at the very minimum, we had Liberal, NDP, Bloc, and Green MPs coming together yesterday to vote down a motion from the Conservative Party that would have taken us further back. And so I think your question is really important. This is, I think, the importance of having moms like Leslie, Ruth, and Christine here, is to bring the conversation back up to where it should be, which is moving further and faster to stop the crisis rather than going backwards and making it worse.
I just want to mention one thing. One of the reasons that we wanted to do this press conference today is that some of what Pierre Poilievre said described that the people that the Liberal government was listening to were, this may not be an exact quote, but sort of pie-in-the-sky theorists, people who weren't connected on the ground, and academics, and paid activists. And when I heard that, and I know that the community that changed my mind around the best way to handle dangerous drug supply was to create a safe drug supply, decriminalize and control, and save lives. And I thought it was a shameful comment that the government was listening to paid activists. The experts here, Christine Nayler and Ruth Fox and Leslie Mcbain, are grieving mothers who know that the loss of their child was preventable and was a result of failed policy. Nobody is paying them. They would give any amount of their life's treasures not to be here.
Thank you.
Thank you.
Thank you. Thanks for being here.
Thank you.